Hello and welcome to the Enhancing Integrated Care webinar. What it is, benefits, and how to join. I'm Colleen Ferris, Director of Innovations and Strategic Development at Healthcare Excellence Canada, and I'm pleased to be your host today. Before we get started, I'm going to go through some of the technical components to ensure all of you joining us from across the country have what you need for a positive online experience. French simultaneous interpretation. Please note that this session is being recorded, and we are pleased to offer the French simultaneous interpretation by Karen Rosbach Communications Incorporated for this session. If you wish to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your screen. If you do not see the interpretation menu on your screen, please select the three dots More menu and select Interpretation. If you need support at any time during the webinar, you can reach out to the participant named Tech Support Soutien Technique using the direct chat feature. We invite you to share your questions and comments at any point during today's session using our chat box in either English or French. We will try to respond to as many questions as we can at the Q&A portion at the end of the webinar. If we have more questions than time, we'll send follow-up responses as part of our post-webinar email follow-up. That will also include the recording and other items. I would like to start by acknowledging that we are meeting on land that has been inhabited by Indigenous peoples since the beginning. In particular, we acknowledge that we are broadcasting this webinar from the Ottawa-Gatineau area where I live, which is the traditional and unceded territories of the Algonquin Nation. We recognize and deeply appreciate their historic and continued connections to these places and the opportunity to learn from and also gather here today. We invite you to introduce yourself in the chat and let us know the lands you are joining from. And thank you to the HEC colleagues in the background who are adding the Native Land website in the chat if you would like to learn more about the territory where you are joining from. Again, thank you so much for joining today's webinar. We're excited to share about this Enhancing Integrated Care program opportunity with you, and we hope that by the end of today's session, you will see how we can help support your team's improvement initiatives. During today's call, you'll hear about HEC's Care Forward movement, how you can take part of this Enhancing Integrated Care program, and we'll also share details about what is integrated team-based care, the activities and reporting and supports available through this program, and we'll have some time for those questions as well. So what is Care Forward? Care Forward is a pan-Canadian movement launched earlier this year to improve healthcare by sharing knowledge and applying proven approaches with support from Healthcare Excellence Canada and partners. Changemakers are driving lasting and local improvements for over 1 million people across Canada. This movement is designed to be inclusive and flexible. Care Forward brings together teams from all types of organizations and those with different roles, capacities, and starting points. So whether you're just at the beginning or scaling an established innovation, there's a place for you as part of Care Forward. Our Care Forward programs focus on 4 key priorities that are connected to HEC's strategic plan: expanding access to care and easing pressure on emergency departments, helping more people age where they call home, advancing safe, person-centered long-term care, and supporting the health workforce. Teams from across Canada can join offerings that align and support their goals, needs, and capacity, while noting different programs and offerings are open at different times. So we have many supporting organizations that is making this possible. HEC and along with 30 plus supporting organizations have come together to offer tools, funding, coaching, spreading the word to create pan-Canadian network of peers. We are so grateful to these partners, to these supporting organizations, and to be working alongside in supporting and making these differences across the country. So, a bit about the expanding access to care and easing pressures on emergency departments, as this is where our Enhancing Integrated Care program offering is connected to. We know everyone in Canada deserves timely access to healthcare, including care closer to home and in their communities. When people can connect to the right care at the right time and in the right place, they're less likely to turn to emergency departments for issues that can be managed elsewhere. So that's why this is one of the priorities under the Care Forward movement. This priority area is guided by 4 policy evidence-informed pathways: supporting community-based health promotion and disease prevention, expanding access to primary care, enhancing care through service integration, and health workforce requirements. Building on these pathways, HEC and others aims to accelerate innovative community-led solutions. And that's where the Enhancing Integrated Care program comes in. This program is designed to support teams committed to delivering timely, appropriate, and accessible care, helping ensure everyone receives the right care at the right time, at the right place. We actually had an initial cohort of teams join this program this past summer, and we've opened up this program for this additional opportunity. Enhancing Integrated Care supports organizations working to enhance integrated team-based models of care, including virtual care approaches that help improve access to primary community care while easing pressures on emergency departments. For this cohort, applications are accepted as of now through HEC's online community portal, and the applications are open until October 31st. So who should join? If you're working to improve team-based integrated care in primary care, healthcare settings, home community care, long-term care, hospital, mental health and addictions, virtual care settings, and others, this offering is for you. Teams must be actively involved in an existing team-based model of care or seeking to improve one that's already in practice. Organizations providing health and or social care connected to primary or community care can apply to this program. Additionally, eligible teams can include regional health authorities, universities, and research teams, and or provincial territorial governments, First Nation, Inuit, or Métis government and organizations, as well as these organizations that they are working in partnership with teams that deliver integrated team-based care. So we're about to dive into, before we go into details of what's all in this offering, I want to just take a moment about a bit of a shared understanding of what is integrated and team-based care. When we talk about integrated and team-based care, we're referring to collaborative approaches where different healthcare providers and members of the workforce work together as a team with patients and caregivers to provide coordinated, continuous, person-centered care, ensuring patients receive the right care at the right time. It's a coordinated approach to healthcare. It aims to provide seamless, efficient, person-centered services across different settings and levels of care. It focuses on collaboration among healthcare providers, social services, community organizations, all towards improving patient outcomes, enhance the patient experience, and reduce inefficiencies in the system. And it is people-centered care that considers relationships between workforce members, organizations, and the individuals, families, caregivers, and communities being served. Integrated care models can look like providers at the same setting, such as hospitals or clinics, collaborating to streamline services and reduce duplication, coordinating care across different settings, including primary, hospital, home, rehab, to ensure smooth transitions and continuity. Multidisciplinary teams made up of many different members working together in the same clinic to manage a patient's full range of needs and improving access and outcomes. Teams integrating technology to enable virtual care, real-time communication across the care continuum. Integrated care can take many different forms, but the goal is the same: better coordination, better access to outcomes, and a better experience for patients and providers. So I want to share a bit about cohort 1 in case this might give some ideas as well. In cohort 1, we have 40 teams across Canada participating in enhancing integrated care, and we're aiming to support an additional 60 teams through this cohort 2. Cohort 1 teams encompass a variety of settings and initiatives, and over the next few slides, we'll highlight some of these examples. In Newfoundland and Labrador, there's a team that will led out of a hospital emergency department that's working on strengthening and expanding their existing geriatric emergency management approach. Their goal is to improve care for older adults, including preventing avoidable hospital admissions, reducing risks like delirium and functional decline, supporting safe transitions back home, and reducing return ED visits. In Ontario, a team led out of a health sciences center is working to strengthen the long-term sustainability and systems integration of their youth mental health and addictions navigation pathway. Their goal is to provide dedicated navigation support at the point of discharge, ensuring youth and families are not left to navigate the system alone and can have access to timely, appropriate mental health and addictions care. In British Columbia, a team led by the local health authority is working to expand and sustain their virtual care provider program across urgent and primary care centers. This work improves access to timely, team-based, and improves patient navigation and triage through digital tools and workflows, and builds capacity for interdisciplinary collaboration and shared care planning. Their goal is to improve access, continuity, and equity in primary care while easing pressures on emergency departments. In New Brunswick, a team led out of a long-term care home is working to implement the multi-specialty interprofessional team, a MINT memory clinic model, within their Nursing Home Without Walls program. Their goal is to ensure a coordinated care pathway that supports older adults maintain independence and quality of life while also reducing caregiver burnout and pressure on acute care and emergency services. So we're excited to be supporting these teams, and hopefully many of you will apply and join our second cohort to work towards teams' goals and our shared goals of ensuring everyone receives the right care at the right time at the right place. So, what can teams participating in enhancing integrated care expect? Let's start with what teams will receive and have access to. By participating teams, you'll have access to unique opportunity to accelerate integrated care initiatives with funding, tools, and tailored supports, including seed funding, that's up to $10,000 per team or site to strengthen your initiative, access to expert coaching through both one-on-one and bi-monthly group opportunities that are tailored to support progress, help address challenges, and sustain improvements and plan for long-term success. This includes access to a professional coach and lived experience advisors. Virtual learning opportunities through bi-monthly webinars and activities focused on key topics like equity, cultural safety, engagement-capable environments, and rethinking patient safety. Tools and resources to support planning and measurement to track progress and demonstrate impact over time, as well as group learning, connecting bi-monthly with other healthcare leaders to share insights, celebrate wins, and drive collective progress. Together, these supports help teams move from ideas to action and from action to lasting change. You can find more details about these supports in the call for applications. Additionally, for teams that indicate that they are from the primary care setting, there is an additional opportunity from a partnership with the Canadian Institutes of Health Research. The Canadian Institutes of Health Research will be funding research teams, and I am pleased to have Megan McMahon, Assistant Scientific Director from the Institute for Health Services and Policy Research, and Tim Bell, Project Lead for Patient-Oriented Research from CIHR, here with us today to share a little bit more on this opportunity. Over to you, Meg and Tim. Right, we will just get Meg connected so can come on. We'll give one moment. Thanks so much for letting us know. Meg, we will fix that. And Tim, you should be able to come on as well. If not, if you could put us just a quick note in the chat.
Oh,
All
perfect.
right.
Can you hear me now,
We can
Colleen?
hear you. Yes.
Okay, sorry about that, and I wasn't
No
able to join
worries.
the previous chat. Hi, everyone. Thank you so much for joining today. I'm Meg McMahon. I work with CIHR's Institute of Health Services and Policy Research, and I'm here with my colleague Tim, who works with CIHR's Strategy for Patient-Oriented Research, and we're delighted to have this opportunity to work with you. The research component that Colleen mentioned is supported via a partnership with the Canadian Institutes of Health Research, which is Canada's federal health research funding agency, with a mandate to support health research and, importantly for this initiative, its translation into concrete, tangible benefits in terms of improved health services, and well-being for people across Canada. We are absolutely thrilled to partner with Healthcare Excellence Canada on the Care Forward Enhancing Integrated Care initiative to ensure that research supports are available to all interested primary and integrated care delivery teams that select the primary care sector in their application. And this reflects CIHR's commitment to primary care as a top priority for the agency across Canada. And we hope that all 60 teams that will be part of this cohort 2 call for applications will opt in for the research supports. You might be wondering why research? What's the value add? We believe the research supports will, in broad strokes, support primary and integrated care delivery teams to advance your goals with success. So health services research and implementation science is really about helping to understand which innovations work, which don't, for whom, in what contexts, and why, and all with the view of improving safer, more accessible, and effective care in stronger health systems. And so our goal by partnering with Healthcare Excellence Canada is to complement the incredible resources and supports that you will have through the Enhancing Integrated Care initiative to help you achieve your goals with the best available evidence, with data to support and adapt as you go, and to support broader learning and impact. We know that the innovations that you're leading are important and will make real world differences for people, community, and populations. And so what the research supports will do is help to ensure that those innovations are successful in your local context, have the potential for broader impact through their scale and spread to benefit more patients, more communities, and more populations. With that, I'll turn the virtual mic over to my colleague Tim, who will share a few additional details. Thanks, Tim.
Thanks, Meg. And I just want to echo Meg in that we're very excited about this partnership with HEC because we do believe that research can truly bring value add to your teams and projects. And I just wanted to double down on some of the things that Meg mentioned earlier about the opportunity to generate data and data-driven insights, which will really give you that real-time or near real-time indication of whether your innovation is having the desired effect, and being able to adapt and improve the innovation on the fly, essentially optimizing your chance and maximizing success. So I just wanted to clarify too that the research supports being offered through the CIHR HEC partnership are in addition to the Care Forward seed funding and coaching supports you would receive, and it's meant to provide you with additional financial and human resources to help identify and use evidence-informed and data-driven strategies. In other words, it's an additional support to help you achieve your goal and is not intended to be burdensome or additional work to your team. So if you're a primary healthcare delivery team and want this opportunity, make sure to check the yes, I'm interested in research supports box in your HEC application. And if you're a primary care researcher on this call, you can partner upfront with the primary care delivery team and make sure the box is ticked upon application. And so after the October 31st deadline, there will be a facilitated process to connect successful primary care delivery teams with researchers. I think that's it for me. Meg, is there anything else before we pass it to back to Colleen?
No, thanks so much, Tim. Maybe just an encouragement to everybody to participate in the research supports. It will truly be value add and support the success of your innovation, and as Tim has said, the broader scale and impact. Thanks again, Colleen, for the opportunity to partner. Back over to you.
Thank you so much, Meg and Tim, and it has been an absolute pleasure and looking forward as we continue on in this partnership and supporting further advancement of primary care quality improvement work that many of you are leading across the country and being complemented and further supported by research. It is such an exciting opportunity to receive that research and evaluation support. So really encourage the primary care teams to consider this as you are applying. And as highlighted by Tim and Meg, if you indicate you are a primary care team on your applications and expressing this interest, we will then share your interest with the CIHR funded research teams who will be in touch. There'll be a facilitated process, as Tim highlighted, and then it will build on shared strengths and interest. Now we'll talk about some of the now we've talked about some of the benefits. Let's just take a closer look at another important piece to help you determine if your team is eligible to apply. As part of the funding agreement with HEC, teams will need to identify and highlight in their application that they will be able to submit quarterly data reports on REACH, as well as one of three measures that's demonstrating the improving access to ease the emergency pressures. The following is an overview summary that successful teams in cohort 2 will be, while noting those successful teams in cohort 2 will be provided tools and support for the reporting needs and requirements, including templates and other tools. For REACH, teams will be asked to share on predicted direct reach, and potential reach. For predicted direct reach, teams share the estimated number of people who will receive care and support from your team while participating in enhancing integrated care. For direct reach, teams will count and report quarterly the number of people who did receive the care support during that quarter. For the potential reach, teams will share the number of people who could have accessed care or support during your participation in the enhancing integrated care program. The teams then choose one of the three ways to measure the improving access to ease emergency department pressures. Option 1 is a patient survey measure. And again, tools would be provided. Teams collect a sampling of patient surveys once per quarter with 1 to 2 questions that HEC provides and can be done either online, printed, or verbally with a team member. Another option is the emergency department usage measure. Teams can use administrative data to measure emergency department usage among their patients. This data can come from sources like electronic medical records, paper charts, or national databases, such as CIHI's National Ambulatory Care Reporting System. Option 3 is only available to eligible teams in northern, rural, or remote communities who do not have access to a local emergency department. These teams are invited to choose an alternative measure to show improved access to local primary community care. Before selecting this option, we ask for teams to reach out to us to determine eligibility and to work together on defining the alternative measure. A bit about the reporting now. Each quarterly reporting will include different measure and data points and guidance of what's needed. All participating teams will be asked to provide project details, reach, progress, measure results that I just highlighted, and near the end of the offering, your team will need to complete a final report and will be asked to complete a brief, and each team member will be asked to complete a brief survey. Your team will also be asked to provide information related to project sustainability at a later date. Leading up to each reporting period, participating teams will be provided with guidance, instructions, and of course support, such as tools or live sessions to support teams with the measurement and data collection and reporting. And teams will also be able to reach out to HEC at any point directly or through the assigned coach for additional one-on-one support as it relates to measurement and reporting. And quite possibly, if there's interest in the CIHR research opportunity, in working with some of the research support as well. Now that we know what enhancing integrated care is and the benefits, let's quickly look at next steps and how to join. If your team is interested in applying for this cohort, a reminder that applications are being accepted now until October 31st, so please apply. After applications close, a review panel made up of HEC staff will go through submissions to ensure eligibility and alignment with the program. Teams who are accepted into the program will be notified around November 17th, and selected teams will be asked to confirm their participation and sign the agreement by December 8th. Each team or site, as mentioned, is eligible up to $10,000 in seed funding. The first 80% will be issued upon receipt of the signed agreement, and the remaining 20% will be issued after completing all the program requirements and submitting of final reports. So we now have an opportunity to hear from you and take any questions that you may have. And we ask you to put those in the chat box, and we'll do our best to answer as many as possible. And I know some of the teams already been actively answering the questions in there. We also do have a frequently asked question document that we will place in the chat to help with answering questions as well. And then we will save some time. We do have approximately a 5-minute video to give a bit of a quick demo tutorial of accessing the community portal where the application is located. So we will certainly make sure that we save time for that. So seeing some questions in the chat, I'm just going to go through and see. I'm gonna, So there's a few questions that have come in about how much funding is available through the CRHR. And thank you, Meg, for jumping in there and seeing some other questions to this effect. So there is no additional funding that is coming to the HEC teams from the CIHR opportunity, though CIHR is funding researchers that will then be able to support the teams. Meg, Tim, feel free to jump on if you want to say anything more to that effect.
Thanks, Colleen. The CIHR research investment is in addition to the incredible supports that HEC is offering. And it is currently, additional information will be shared following the peer review notice of decision, which is coming soon. And so what Tim and I can share at this stage is that the human and financial resources through it are in addition to, and they will be shared across the primary delivery teams based on the number of teams that engage and the needs of those teams. And so there will be a thoughtful alignment and matching process that CIHR, HEC, and the funded researchers do to ensure that the additional resources are spread across the delivery teams that are engaged in it. And if you sign up, I'll pop the link to the ISPER the Institute of Health Services and Policy Research newsletter in the chat. And if you're not always already a subscriber, additional information will be coming out next week that will help to shed some light on some of the financial questions that you're asking. So thank you for your patience. And at this stage, it would be incredible if you would opt in. It's really intended to enhance. There's no risk for doing so. And the more teams that engage, the greater benefit to shared learning, collaboration, and the potential for spreading the impact across larger jurisdictions and populations. Thanks, Colleen.
Thank you so much. I am seeing some questions about some eligibility. So to confirm that whether it's universities, teams, health authorities, governments, other organizations, you need to be partnering and working with teams that provide publicly funded healthcare services. Just going through some of the other questions here. We will be sharing the recording and not just the recording, a lot of key links and with all that are there. There's questions about program suitability. I think Yusuf, you highlighted a paramedic service looking to integrate care from pre-hospital setting to primary care. Absolutely, as long as a program is started or right about to start or already underway, looking to improve it, and that the team is able to address the reporting requirements as well. Just checking in on some of the other ones. So you can apply as a multi-site. So if you are working with other sites, you can apply as with one application, but then you will be prompted within your application to highlight the other sites as well. Can organizations submit two proposals, different focus, and different partners? Absolutely, you can, as long as given that they are different, if they are different initiatives and work underway and different ways of reporting the improving access to ED measures, that works. Just going through, we've got so many questions. It's good to see. We've talked about the multiple sites. So if you are, and do know that if you are part of another HEC program, do reach out and we're happy to discuss opportunities. I see a question here about, and I highlighted about, even if you have the same team members, so say you are a site, two different initiatives, same team members, as again, if it's different initiatives and reporting differently, do consider applying. I see a question. Support different agencies, but we're not primarily primary care. Again, if the service is connected, if we think of some of those examples as it relates to integrated care, as long as there's that connection to primary community care, there is a connection and a potential opportunity for the Enhancing Integrated Care program. See a question about eligibility of funds, and I will just flag in the call for applications. There is a more detailed table about eligible expenses, and in there it also highlights that seed funding can be used for release time, but not to cover salaries. See a question is, so the seed funding is up to 10,000, but what is the minimum amount a team could receive? If a team does not feel the need that they need seed funding, but they still want to access all these other tools and services, such as the coaching, the virtual networking, we please do reach out to us because we could look to explore. We would still require an agreement in place, but if funding is not required, we can discuss that. Just seeing if other ones coming up. Thank you, Meg, for adding in information further. I'm just trying to see a few that are coming in here. So when I think in considering the scope, we know it's not the enhancing integrated care is not solely primary care. Now, granted, the CHR research opportunity is for teams that do indicate that they are coming from the primary care setting, but enhancing integrated care is open more broadly. So as we highlighted some of those ones from our first cohort, they are providing mental health and addiction services and integration of care, long-term care program facilities, working with community as well. So it is a broader scope than solely primary care, but just highlighting the it is the CHR opportunity that will only be open to primary care setting teams. So whether it's second line teams working with mental health patients or in other addiction treatment centers, there is an opportunity. Yes. So the for the application, the criteria and there is eligibility details listed within the call for application. So needs to be providing the organization needs to be providing publicly funded social health services. If it is not a direct organization, that they need to be working already in partnership with organizations that do deliver publicly funded care. See some questions about what the potential research could support with, if it's not evaluation support, around data sharing. So thank you so much, Meg, for highlighting. Those are type of questions that when the research team connects with the funded team, with the HEC teams, those are conversations. And again, to make sure an added value for all. How you've addressed privacy legislation into, so for certainly for as it relates to the HEC required data. So there's a question about privacy legislation and developing data sharing agreements. So HEC only requires aggregated data. We do not ask for any personal health information. So for example, for that patient, that sample patient survey, it is a tally. X number of patients indicated that by accessing this service, they did not need to go to the emergency department. And within the HEC agreement, also it does indicate some guidance further for sites as it relates to ensuring that sites have the necessary consents and practices in place based off of each practice environment has its own, each practice environment has their own items that they need to be followed. Just checking in with the team. I'm trying to follow as many of the questions that are coming in. Talked about some of the examples of like the second line. So if working with cardiac specialties and looking for other programs, again, it's that integrated of service. So I certainly would see this something that could be possible. And again, never hesitate to reach out. We will be sharing at the end our central application intake, and we are happy to address any specific questions for the individual applications. Just quickly going through the list of questions. Can you share the opportunity? So the research, again, when the HEC teams are known later in November, and there will then be the connection with the research teams, and the research teams will reach out to the HEC teams to discuss and have conversations from there. What maybe we'll do as maybe I'll look to the team, as we do want to make sure we share the video that gives a brief tutorial about the use of the community portal. So I'll maybe look to the team that we get that up online. And then if there is other questions that come in, and I'll be able to check that we've answered as many of them as possible. Thanks, team.
Welcome to HEC's Community Portal, a secure space where you can apply to and manage your participation in HEC offerings. Let's get started by setting up your account. This will ensure you stay up to date on the latest offerings. As a first step, select Get Started and then Sign Up Now. You'll be prompted to enter and verify your email address. Once you receive the verification code via email, enter the code into the form to complete your registration. From there, you can complete your user profile and you're ready to go. From the home page of the Community Portal, you can explore HEC's current offerings and learning opportunities. To apply or register for an offering, select Enter Here to access HEC's program management platform directly from the portal. Here, you can view and submit applications for active HEC offerings, invite others to collaborate on your application, and manage reporting, including progress and financial reports. On the home page, you'll find a list of active HEC offerings, key program details, important dates, and eligibility requirements. You'll also find helpful guidance on how to navigate the platform and access the information needed. To get started, click on Apply Now in the left-hand menu. From the Apply Now page, click on the Application button for the offering you're interested in. Then complete the appropriate application to register or apply to participate. It's important to remember that the portal does not auto-save. Be sure to regularly click Save or Save and Close at the bottom right corner to avoid losing your work. You can save your application and return to it later, as long as it is submitted before the application deadline. To support the completion of your application, you can invite a team member to collaborate. When completing the team member information, check the box labeled Invite Team Member to Collaborate on this submission. They'll receive an email notification and be granted access to work with you on the application. The email will include a link for your team member to create a user profile in the HEC Community Portal to access the application in the Program Management platform. When your application is complete and you're ready to submit, the Submit button will appear, but only after you've saved and closed the form. Keep in mind, once submitted, you'll no longer be able to make changes to your application. To view all applications you're collaborating on, select All from the drop-down menu at the top left of the screen. After all required information has been submitted, the team lead will receive an email notifying them that their application has been submitted. If HEC staff need more information about your application, the team lead will receive an email outlining what's required. You'll be invited to log in to the program management platform to make edits or provide the additional details requested. The team lead will be notified of the outcome of their application via email after the review process. If your application is successful, you'll be enrolled in the offering. Each offering comes with an established reporting schedule for all participating organizations. To submit a report, go to the Report section in the left-hand menu, then click on Due. Here, you can view your upcoming reports and submit the required data. You can also view previously submitted reports under the Submitted section. If you're enrolled in the challenge offering, you may be eligible to apply for awards. To apply, go to the Admitted or Awarded section, select your active enrollment, and look for the available award option. If an award is currently open, click the Submit button to complete and send in your award application. Once submitted, the team lead will be notified of the outcome and any next steps following HEC's review. Now that we've walked through the HEC Community Portal and the Program Management Platform, here are a few key reminders to keep in mind. It's important to remember that the portal does not autosave. Be sure to regularly click Save or Save and Close at the bottom right corner to avoid losing your work. You can save your application at any time and return to it later, as long as it's submitted before the application deadline. When your application is complete and you're ready to submit, the Submit button will appear, but only after you've saved and closed the form. Keep in mind, once submitted, you'll no longer be able to make changes to your application. To view all applications you're collaborating on, select All from the drop-down menu at the top left of the screen. If at any time you need help with the application process, be sure to check out our frequently asked questions and call for applications documents. These resources include valuable details like eligibility requirements, important dates, and guidance to support a successful application.
Wonderful. Thank you so much to the team to share that, and hopefully that provides a nice initial snapshot of understanding of our community portal that's online for the applications. Did see another question and theme come into the chat during the video, and it was asking about, can teams applying to the Enhancing Integrated Care also apply to another opportunity that HEC has opened, the Right Care Challenge, and teams, if you do apply to the Enhancing Integrated Care, you could also apply to the Right Care Challenge, though if it is for the same element of work, the reporting can only be submitted for one of the program offerings. So you could not be doing the same initiative and reporting in for both of those programs. So I understand that there was a lot of information shared in today's session. We've included a few helpful links in the chat throughout for quick access, as well as we'll give access to the EIC, the Enhancing Integrated Care webpage, as well as the application portal. And all of this information will be provided in the recap email along with the recording of today's session. And do know the HEC team is here to help you and your team and organization create a bigger impact in your community and beyond. So if you are interested in applying or need additional information for consideration for this cohort, please do not hesitate to contact the team at the email address that's posted in the chat. Application demand at hec-esc.ca. We want to thank you again for all of you who have joined us today. We hope that you have found it informative and will join us in this pan-Canadian movement focused on improving health outcomes, care experience for patients and providers, and the value and equity of care. I'd also like to thank again Tim and Meg from CIHR for joining us today, as well as our colleagues behind the scenes who have ensured today's event ran so smoothly. And a shout out to Sheena Sherwood, Carol Rondo, Stephanie Conrad, and Alessia Fricelli. Thank you so much for joining. Wishing everyone a great rest of your day.